Cool. Yes, we are live. Great. There are people. That's awesome. So we can get started. I just want to say a quick intro remarks to kick us off this evening before our amazing panel talks to us about this important issue that's happening all the time, but particularly during COVID. So I'm Lauren. I'm on the UDC Executive Board, and I work on some of the events that we've been having during this crazy time. And we are so excited to be partnering with SFWPC on this important issue that affects a lot of people, but particularly women. And if you want to learn more about us, follow us on social, get involved at iadems.org, and continue to show up and learn about all the amazing things that our teams are putting together while we're at home, on Zoom, learning things on webinars. So with that, I'll have Sharon Chung from WPC tell a little bit about your organization and the work we all do together.
Hi, everyone. Thank you so much for joining us this evening. We're so excited to be partnering with United Democratic Club on this very important panel. My name is Sharon Chung, and I'm the events chair for the San Francisco Women's Political Committee. We're the largest women's organization in San Francisco with the mission to engage female identifying individuals in all dimensions of the political process and to increase awareness for the women's issues that affect families and children all across San Francisco. You can find out more information about how to join and become an SFWPC member at sfwpc.org. And now I will turn it over to our lovely moderator, Jarlene Choy, to start our programming for tonight. Thank you.
Jarlene, we can't hear you.
Ah, there we go. Okay, I've unmuted myself. So thank you United Democratic Club, SF Women's Political Committee, our panelists, and everyone, all of you, for showing up tonight, especially after a full day of work for many of you, on such an important topic that is domestic violence. So we're really excited to hear from you, your questions, and tonight we'll learn about how COVID is impacting domestic violence survivors, as well as what are policymakers and community-based organizations doing to support survivors, and also what resources are available to directly support survivors, but also friends, family, and colleagues who want to support survivors. So to briefly share my connection to the issue, I previously worked at Futures Without Violence, which is a national gender-based violence organization based here in San Francisco. And it was one of the lead organizations in helping to draft and pass the historic Violence Against Women Act of 1994, which was sponsored by Biden. So this act, VAWA, was historic in that it first defined and established domestic violence and other forms of sexual violence as federal crimes. And this was only less than 30 years ago, mind you. And it also created the first dedicated federal funding stream for rape crisis centers, as well as expanded services for supporting survivers. So it's a very important piece of legislation in the history of domestic violence. And currently, VAWA is being reauthorized, or, well, it's up for reauthorization at the Senate. So I encourage all of you to contact your senators following this panel as a call to action. And so specifically during COVID, to set the context, shelter-in-place orders were instated to flatten the curve and protect everyone's public health. However, for domestic violence survivors, this means that they are further isolated in their homes with their abusive partners. And so home for them is one of the most dangerous places to be. And also during the pandemic, we've seen surges in gun purchases, and this is due to many factors, but research has shown that abusive partners who have access to firearms, in these situations, women are 5 times likelier to be murdered. So the connection between gun violence and domestic violence is very clear. And so that's why gun violence prevention organizations like Giffords, where I work, this is an organization that was formed by Congresswoman Gabby Giffords, who's a gun violence survivor herself. We've been working with lawmakers and law enforcement to make sure that laws are in place to strengthen laws during this time, especially to protect survivors. So before we move to our panel, I'd like to remind everyone to be mindful and respectful of survivors that may be on our call tonight. So when you're using the chat box, thank you, Sharon, for typing in the hotline for anyone who needs it. And also, given the topic, if you need to take a break from the call, please do what you need to take care of yourselves tonight. And with that, we'd love to better understand who's on the call tonight. So we'd love our audience to just take 10 seconds into the chat box. Please share if you feel comfortable, if you're an advocate, a policymaker, or if you identify with another type of role. And then second, please type in one takeaway that you'd like to get from tonight's call. So if everyone can do that now, that would be wonderful. Okay, so I don't see any chats. Does anyone see any? Okay, there's someone who typed, "Hi, Marquita." Yeah, this is just a way for us to make sure that what we're sharing tonight is useful for you. So if you'd like to share throughout the call something you'd like to learn from tonight, please do. And this will help us better serve you. So thank you for joining us again, and let's meet our panelists. And let's first have Akiko introduce herself, and then we'll go by alphabetical order by first name. Akiko?
Hi, thank you very much for putting this panel together. So my name is Akiko Takeshita, and I work as a managing attorney at Asian Pacific Islander Legal Outreach. We provide legal services to San Francisco County and Alameda County, several other counties, depending on our funding. DV, domestic violence and family law are major projects within our office. And I'm happy to be on this panel because there are some challenges under the COVID stay-at-home orders. The courts have been open for emergency orders like domestic violence orders, but I don't think a lot of people were aware of that. I know for our office, we're physically closed, but our phones are open and our emails open. And we didn't really get a lot of calls like in March and early part of April. However, I mean, I don't know, good news, bad news is we're getting a lot of calls now. Good news in the sense that people are reaching out. Bad news is the sense that there's a lot of calls. I think we got 2 restraining orders today. I just saw one of my team members. So we're getting, I would say, almost double the calls under normal times. So it just kind of goes to show you that the need is still out there. I don't know if it's just been bottlenecked, but the courts are open. And that's the one thing that I guess is a silver lining, that we're able to still get orders to protect people through the civil courts. However, as I'm sure everybody will touch upon, it's still a really difficult time for a lot of domestic violence survivors right now.
Thank you, Akiko. Nicole?
Good evening, everyone. It's a pleasure to be here. My name is Nicole Lindler, and I'm the policy advisor for Mayor Breed on domestic violence. I'm also the vice president of San Francisco Women's Political Committee. And I'll just say that we are so thrilled to have this topic tonight because it is so important. We know, as Jarlene said, that not everyone is safe sheltering at home in place. And I'm excited to dive into that, to dive into this topic about what we're doing for survivors here in San Francisco.
Thank you. Orchid?
Hi, everyone. My name is Orchid Pusey. I am associate director. I was associate director for a long time. I still don't say it. Executive director at Asian Women's Shelter here in San Francisco. And I've been there for 18 years. We're a program that does all sorts of direct service, crisis support work, case management, and longer term change work, as well as community-based cultural change and systems advocacy work. I'm so glad you're all here today.
Thank you. And Sonya?
Hi, everyone. I'm Sonya Passi. I am the founder and CEO of FreeFrom. We're a national organization actually based in LA. And our work is working to dismantle the nexus between domestic violence and financial insecurity. We know that the #1 reason survivors stay in and return to abusive situations is financial insecurity, not being able to afford safety. And so everything that we do is with a lens to how do we build an ecosystem to support survivors' long-term safety, long-term healing, and through that, how do we break that generational cycle? And just everything is sort of operating from the standpoint that we end domestic violence by investing in survivors.
Thank you. So just a reminder to all the audience members, feel free to submit your questions through the Q&A, and Sharon will save those for the panel, the Q&A that will start around 6:10. But for now, we'll start with the panel. So first off, Orchid, what is domestic violence? What does it look like? Who experiences it? And what are some of the obvious and not so obvious warning signs?
Sure. So I'm going to go through this quickly. And so I just want to start with a message for everybody that this is going to be fast, like sort of panel style. This is heavy stuff that I'm saying really quickly. I would normally not give a laundry list of these things to anybody's ear because it's hard and it's real. It's so far from some strange esoteric topic. It's people's lives. And so I want to apologize for the manner, but give you the content. So domestic violence, in a really blunt form, domestic violence is a pattern. It's not a one-time thing. Even if you're seeing it for the first time, or even if it shows up physically only one time, it's about a pattern, visible or invisible to outsiders. The pattern has coercive control at the center of it, of a person or a family, or a person and their family and their congregation, or a person and their family and their whole community colluding in controlling somebody else or a whole family. And the tools that are used to maintain that coercive control over somebody range a lot. And so, you know, as people have already said in the chat box, you already know, it's not just physical violence. Physical violence is obviously a part of domestic violence, and the physical violence has a range in and of itself, from property destruction and vandalism all the way through feticide, child homicide, adult homicide, elder homicide, self-harm, the threatening of self-harm. So it's a wide range that we're talking about. And then when we look at other tools to maintain that coercive control and hold the reins on somebody's life, there are other tools. So of course, emotional abuse and psychological abuse are harder for some in our communities to wrap their minds around, but are absolutely part of domestic violence no matter what. Destroying somebody's relationships with the people that matter to them, their family, their friends, their children, that is another tool. Creating an environment of isolation, of financial control, running up somebody's debt, getting a credit card in their name and running it up. Making sure that someone can't manage their own finances, making sure that someone doesn't have control over any money in the household. Those are all other examples of tools of domestic violence. And I think overall, creating an environment where a survivor knows every day that they're oscillating between different levels of dread and horror that someone else controls, and that the weather of their life is set by somebody else. That person sets the tone of the day, they set the tone of dinner, they set the tone of the summer, they set the tone of everything. And their emotional state defines the state of everybody else. Everybody else's safety, their ability to sleep that night, their ability to make choices about their own lives. Usually, of course, the last thing I'll say is that really, if your sense of control and stability comes from dominating someone else, you're going to use everything that you have. So there's no sort of exhaustive list of the tools of domestic violence that we memorize. It's not like that. It's more that we look at the social context around us all the time and look at imbalances of power all the time everywhere, because those are the same imbalances that will be used in domestic violence. So in many cases, we'll see people using social power to dominate. So if one person speaks English and the other doesn't, if one person has immigration status and the other person doesn't, if one person isn't out, that can be used against them. If one person feels under great threat, if police are anywhere on site, that's going to be used. People will also go the opposite way, though. It's not just someone with social power who is committing domestic violence. It's also people with a lot of social vulnerabilities who are committing domestic violence. So someone might be just as likely to use their social vulnerability to manipulate as someone would use their social power to dominate. So we look out for all of those dynamics, and domestic violence, I'll say, happens to everybody. It's just that it's exacerbated by different things in different communities. But it's certainly not that sort of the root cause is systemic oppression, given that we have people in the highest echelons of the 1% who absolutely have domestic violence going on. But of course, systemic oppression exacerbates. In terms of warning signs, the last part of your question, I would say that, you know, there are usually the signs, the domestic violence develops over time. It's not like the first time you meet someone, you know, there's like humiliation of you, shutting you down, much less physical violence on your first date. Obviously, that's not how it happens. It's usually quite insidious. And the warning signs are hard to believe, especially if social conditions and social norms have trained you to question your intuition, to question your read, and to think that you should put up with quite a bit to get any kind of positive attention or protection. So some of the warning signs that I talk about most frequently are things like, you know, if early on you can see that if something happens and the other person wasn't consulted or they weren't part of the decision-making process, that somehow turns into a big thing. Like somehow that is always going to become a big thing. That can show up earlier than someone, you know, burning something that matters a lot to you. Obviously, there's going to be some time span that happens between those two types of actions. If somebody never takes responsibility for themselves, if somebody always has sort of their primary emotion in the world is anger first, or their primary sense of themselves is a victim, they're always the victim of everything. Everyone is always trying to shut them down. Ironically, that is a very, very common early sign of someone who abuses. Is someone who thinks that everything is against them and they need to fight for their survival. And in that story, they are never responsible for any condition they live through or any action they take.
Thank you, Orchid, for that very comprehensive answer. And I know there's a lot to cover and it can be very heavy. And so I noticed in the chat box that we have some mental health workers, some social workers. We also have some survivors on this call. And so, Orchid, if you could also share, are you hearing anything different from survivors about what they're experiencing during COVID?
I think with regard to COVID, the main thing I'll say is just like it's like anything else, it's an exacerbator. So anytime you have increased stress, increased fear, increased job insecurity, increased vulnerability socially, increased anxiety, the domestic violence that was already there is going to get worse. And so we've definitely heard that. We had originally at the very beginning, you know, people have access programs in different ways. So of course people have less access to privacy. So just to reach out for help is harder. There are fewer ways to reach out for help. People who normally would go to their parents who have supportive parents, that's lucky already, or people who have a supportive neighbor or supportive friends are much less likely to think that that is a continuing resource, or they know directly that it's not, or they make the choice themselves because their parents are elderly and they're not going to bring other risks into their family's house in addition to the sheer risk of being a survivor of domestic violence who runs to somebody else's home. So the calls that we've been getting, they ramped up in the very beginning. We had a lot of calls from immigrant and refugee survivors who are living in the intergenerational households where literally everybody is under more stress. And the person at the bottom of the ladder who bears the brunt of everyone else's emotional, who takes all the responsibility for what their well-being and has none of the authority, is calling and feeling like they don't know how to survive. The compilation of pressures in addition to the increased intensity of the control and the violence. So I think that it's a combination of the intensity going up inside and the loss of resources outside that has made for a very tough situation. And then there are survivors who are trying so hard to get free, who have already been in contact with one of us, with one of our programs, or one of the many other programs, and they just got that first job. They just got that first paycheck that they controlled. They have their own bank account, and that got lost during COVID, that they are at the bottom of the hiring tiers. They're the first hours to get cut, the first job to get cut maybe. And so they're facing exactly what Sonya's working on, is back to that intersection of, do I land in another situation, which is my only source of economic survival? Do I go back to the bad one because it might be a source of economic survival? So those are all really active situations survivors are facing.
Thank you, Orchid. So with all of the unique challenges that you shared that COVID has been presenting, I'd love to hear from Nicole, what elected officials, how they're responding, and also what is being done here in San Francisco.
Yeah, definitely. So as I said, we know not everyone is safe sheltering in place. And even before that, on a yearly basis, the city has been very committed to helping domestic violence survivors and resourcing organizations that do this work. Currently, we provide about $9 million in grants to 26 community-based nonprofit organizations that provide these type of critical services to youths and adults that, like Orchid said, are experiencing some type of domestic violence, stalking, intimate partner violence, etc. And these organizations really act as a conduit to our crisis lines and for intervention and advocacy. Most definitely, they are providing legal services and helping to do some work in prevention along with education. But particularly during shelter in place, we've had to ramp up support. We all know that there's been an increase in calls to SFPD. There's been an increase in calls to some of the hotlines that our partners have and are running. And so we know that we needed to increase kind of what we were doing. So one of the things that we've done is that we launched text to 911 over shelter in place, which was kind of groundbreaking in San Francisco. We didn't have that before. And particularly we did that because of domestic violence, because we know that sometimes it's way too dangerous to dial 911. And we want to make sure that survivors have that option. Of course, anyone can use that option, but when we launched it really was with domestic violence in mind. Secondly, another thing that we did was that we secured 20 furnished apartment units for survivors, because we know sometimes when you have to get out of that situation, if you have nowhere to go, that just keeps you trapped. And we don't want survivors to feel like they have nowhere to go. So we were able to do that. And of course, we're hoping to add more. We can all agree that 20 is probably not enough, and we're going to try to ramp that up. And then recently, the mayor released a public service announcement on family violence, which incorporates kind of domestic violence, but also child abuse and other types of intimate violence. And I thought that was a really bold statement to come out and do a public service announcement and say, here's how you can find the resources that we have in San Francisco. And no one should be afraid to ask for help. Like, we are here for you. We will provide you with the resources. please call. Please do not wait a minute longer. We've also held a town hall with our Department of Status of Women on this topic, and we are in the process currently of putting up posters around San Francisco that's going to have all the domestic hotline information along with family violence resources, so that anyone who's experiencing that, they'll easily be able to hopefully see those numbers. And we're going to do it at places where we know survivors frequent, like grocery stores, banks, laundromats, etc. And then the last part of your question was what's being done to protect survivors. So our domestic violence crisis hotlines, they've remained open. They continue to support callers and provide resources, which we're grateful for. They are essential workers in that sense. And our service providers, they've really adjusted their platform, so now that they're able to go virtual and provide these services to vulnerable populations. So that's been awesome. And we've also relied on organizations such as, you know, the ones on this panel, of course, but then also Bay Area Legal Aid for their legal advice line to get survivors connected quickly to support. And even before shelter in place, I had the pleasure to work on an app that we launched in the Bayview. We put on every officer's phone to be able to do a lethality assessment when officers are on the scene and they're answering a survivor's call. They ask them a set of questions and they assess right then and there, what is the risk for this person? And if they score a certain amount, they are telling them, you need to go. We will connect you to resources tonight. You do not have to wait a second longer, because we know that every second a survivor waits could possibly turn into a deadly situation, and we don't want that.
Thank you, Nicole. So I know we have so many questions and so little time, so I want to make sure that all of our panelists have an opportunity to share. So Sonya, could you share a little bit more about what your organization is doing responding to the economic insecurity during COVID? And then I'd love to ask Akiko about legal resources.
Yeah, absolutely. So 2 big things that we've done. The first is we launched the Survivor Safety Fund about 2 months ago to get cash directly to survivors who need it. It was a rapid response fund. We started to raise the money and then started giving it out as soon as we had it. We have been able to get almost $270,000 to 1,100 survivors in small grants of like $250. And that money, people are most commonly saying they're using that money to buy food. And that is their most urgent financial need right now. And although we made kind of the application process very simple, we also asked people if they had a minute and, you know, their application wasn't contingent upon it, to answer a couple of questions for us so that we could really hear directly from survivors what they need right now. And a couple of things that we're learning. The average dollar amount that survivors are saying they need in order to stay safe is $745, which, when you think about the grand scheme of philanthropy and how much it costs to solve systemic problems, that's nothing. The top 3 needs that survivors have are cash to spend as they need it, utility bill relief, and credit and debt relief. We're hearing, like Orchid said earlier, exacerbated financial abuse. A lot of survivors not getting access to their stimulus checks as a result of that financial abuse. And then I think one of the things that Orchid touched on that's really important to remember is typically domestic violence, we address domestic violence as a crisis, but all that really means is that we as a society only really pay attention to domestic violence once it reaches that point of such acute crisis. But more likely than not, that person has been experiencing that for potentially years beforehand. And so, you know, people were looking to see if domestic violence incidents were going to rise during COVID, but what does that really mean? It doesn't mean that people weren't experiencing this at great numbers before, and maybe their situation hasn't changed at all during COVID, but it doesn't mean that it isn't dire. And I'll give you an example that we heard from a survivor. She had planned that this was going to be the year that she would leave. And what she was doing was she was saving money. She would, when her harm doer went to work, she would bake. She would go out and sell what she baked, pocket that money, and her harm doer was none the wiser. And she had mapped out how long it was going to save her enough to be able to get out and not have to come back. And so she wrote to us and said, what this means is it's going to be probably 2021 before I leave. And really just thinking about what does it actually look like to be a survivor, and what is needed to really support someone in getting out in a way that feels right for them, or staying but making the best of the situation that they can. So that was the big thing that we did, was a safety fund. And the other piece was we created a COVID response guide for everyone to know what they can do to disrupt intimate violence. And it's available on our website, and it has tips for employers, for community members, for banks, for city, state, federal governments, for hospitality and lodging industries, for religious organizations and churches, because this is a systemic problem. And our responses to date have been Band-Aids. And what it will really take to end domestic violence is every single pillar of our society taking accountability for their piece of it, employers, banks, et cetera, et cetera. And really, I think we have a window of opportunity here during COVID, while people are essentially experiencing firsthand what it's like to feel trapped in your home, and that expanding the ability to empathize for what it must be like to live like that and live with added dangers on top of that, to really get some real change on the books, and to really galvanize all of that interest and the interest of people that have joined us today, and people asking, what can I do? I think we have a real moment here during COVID to make sure that when COVID is over, survivors aren't still trapped because we didn't do anything to support them during this time.
Thank you so much, Sonya. It's really encouraging to see how rapidly your organization and others have been responding in very innovative ways and getting cash directly to survivors. And so, Akiko, could you briefly share some of the legal resources? And then we'll take one more question, and then we'll go to Q&A.
I think we're fortunate in California, as well as in the Bay Area, that domestic violence is taken seriously. And like Nicole said, there's 26 organizations that are funded in San Francisco. We're one of them. There's shelters that are available. There are social services that come with a lot of the shelters. We do legal services, and oftentimes I say, and I agree with everybody on the panel, is like domestic violence, by the time we hear about it, it's been happening for a really long time. And when by the time they get